Hi, so it is now my great pleasure to introduce our second keynote, and I'm incredibly grateful to Tissa Wijeratne, who is a neurologist. Tissa is going to be talking to us about promotion and prevention, which is one of the objectives of, again, the IGAP plan. And he is a professor in neurology and clinical associate professor in medicine at the Western Health Clinical School and University of Melbourne. He holds adjunct professorial roles at several universities and is the co-chair of World Brain Day, leading the program on behalf of the World Federation. World Brain Day is tomorrow, so this gentleman is a very busy man this weekend. He has published papers, given international lectures and supervised neurologist training. He is dedicated to bridging the healthcare gap between rural and urban areas and the developing world. He was awarded the Order of Australia Medal for contributions to medicine, and I welcome Professor Tissa Wijeratne. Thank you.
Thank you, Etta, for those kind words. I'm grateful to hear that my good friend and colleague David Blacker is sitting behind also. And I also acknowledge the traditional owners of this land. Given that I arrived Melbourne this morning sitting in my home study room at the moment, which is belong to Wurundjeri, the nation, Wurundjeri clan cooling nation, and I respect the elders past, present, and emerging, and I equally dedicate my respect to the similar people in your soil also. So the topic that was given to me is IGAP Strategic Objective, Implement Strategies for Promotion and Prevention. I spent 4 days in Sri Lanka, just arrived, and I had a couple of tasks back in Sri Lanka. My mother, who is 79 years of age, who is the superhero of making me who I am today. I am the first university graduate from my rural family, and I went on to become who I am purely because of early morning shouts and waking me up, forcing me to study. Although I didn't like that at that time, it helped me to help the world later on. Unfortunately, she is slowly losing her marbles, and I made it a point to take her around in between couple of workshops that I did during last couple of days back in Sri Lanka. We also managed to collect the 2 allied health folks from each major hospital in Sri Lanka while I was there. We brought them to Colombo, and then I forced 2 of my friends who are working in London at the moment, originally from Sri Lanka, as a senior OT and PT, to train them on how we can set goals and help fellow Sri Lankans with brain disorders to extract the best that they can be. In between, I kept pushing my mum, who was struggling to get into the vehicle that we were traveling 3 days back. But the last night, just before I left the hotel that we were staying in, she was independently walking and greeting me with a good state. So the reason that I shared those couple of little stories is that we should never give up to extract the best out of our brain until we are done on this planet. And I also encourage you to visit my other charity, where we are trying to create 5 million steps for migraine in Australia. The migraine is the leading cause of disability in Australia, and there are 5 million people, and it continues to remain quite neglected in Australian soil, sadly. Let me see whether I can get to the next slide now. All right. If I haven't convinced you enough, the why should we care, you all are gathered in that hall today, and I have done what I have done over the last couple of days and continue to do today and tomorrow globally, also purely because of this magnificent organ called brain. And it is our brain who makes us who we are today. And I put a big picture of eye as eye is basically the window to the brain and basically decide almost 90% of our behavior. There are a whole lot of untapped resources in eye-brain connection, and the put some attention to this area also. Of course, we should not forget our peripheral nervous system also. I'm standing in front of my PC at the moment, and I'm doing that thanks to my peripheral nervous system and autonomic nervous system. So brain is the most amazing organ in our body, and it helps us to survive as a species and protect our planet and leave this planet to future generations if we take care of our brain as well as our planet together. Unfortunately, brain disorders are the leading cause of disability and second leading cause of death at this point of time. It is certainly the case in Australia also. As of this morning, there will be over 100 million stroke survivors worldwide, over 3 billion headache disorder sufferers worldwide, including myself, over 50 million cases of dementia, that include the superhero who made me today, and over 12 million cases of Parkinson's disease, and over 3 million cases of multiple sclerosis, over 50 million cases of people with epilepsy, and over 100 million cases of long COVID that our group redefined as post-COVID-19 neurological syndrome in the middle of the pandemic. The key thing is almost all of these disorders are preventable, and effective treatment and rehabilitation options are available. And also, don't get carried away that some of the disorders, you heard the beautiful the presentations from Rachel and her colleague before, and things like Japanese B encephalitis, we are not immune from these disorders. Although we could stop Homo sapiens from traveling to countries by putting a lot of restrictions, you cannot stop the birds and others crossing the boundaries. So most of these infections are uniquely abundant all over the world. Yet most of these disorders are preventable also. We learn from COVID-19 pandemic, there are good things that we can do to prevent this disorder from hitting us, including vaccination. Parkinson's disease also, we are learning fast that there are preventable cases, dementia up to 40% we can prevent, strokes. My good friend David Blacker would agree with me that nearly 90% of them can be prevented. People like my mother developing cognitive impairment, at least 40% of this can be prevented, although we are a long way from all those things. Let me now take you back to the original definition of health by World Health Organization. Most of you, unless you're originally from Sri Lanka, would not recognize the letters on the right hand of the slide. So the right hand of the slide, it's in Sinhalese letters, but taken from Pali language, which was the common man's language during the Lord Buddha's time, the 2,600, 2,700 years ago. And it says, Arogya Parama Lahava, that means the health is the best wealth that one could ever achieve. I wouldn't go into the rest of the other detail. That's almost 3,000 years ago. Now let's go back to 1987, when I was still a high school kid. World Health Organization told us that health as the state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. Despite we did not have a proper definition for brain or brain health at that time, you can see that both these pieces 3,000 years ago and 1987, it's clearly recognized the importance of brain and brain health when it comes to health. You cannot maintain complete physical, mental, social well-being, not merely the absence of disease or infirmity, without having reasonably well-functioning brain function. Fortunately, after a lot of work from a lot of organizations and the many of us who put a lot of labor over last 20 decades or so, World Health Organization came up with the first brain health definition May of last year. It goes on to say that brain health is the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing person like my mother to realize their full potential over the life course, irrespective of the presence or absence of disorders. I strongly encourage you to read this white paper, which I'm sure will continue to expand in time to come. Coming back to my theme, I already told you that many brain disabilities can be prevented, treated, and rehabilitated. This starts with awareness. I remember joining Western Health, which cater for people coming from 166 countries. So almost every second patient that I see speak a different language, looks different, the culturally slightly different. Yet in the 2006, as a first year consultant, when I did a survey with a bunch of medical students, 85% of my patients did not know that stroke is a disorder arising from brain. Among the big 5 brain disorders causing disability, stroke is number 1, headache number 2, then cognitive impairment, then brain infections, then epilepsy. Every other 400 plus brain disorders are uniquely important, but these are the big 5. So raising awareness is the key to address this issue first and foremost. This doesn't need money. You listened to Paulette before. I remember one of my mentors from Sri Lanka in 1970s, while I was a primary school kid or not even going to school, he did this, the province-wide survey, which I talked to Tori Robinson from Epilepsy Sparks, that you could look through the YouTube. He was able to use a volunteer organization to run a really fabulous epidemiological study and put the numbers into context and give the world a really well done epidemiological study from Sri Lanka at that time, when Sri Lanka had only one neurologist to cater for whatever the population that they had at that time. He didn't stop there. He made a movie called Across the River in local language, trying to address the stigma associated with epilepsy at that time. So it is important that we put all our sources together to raise awareness in whatever the way that we can to protect and promote brain health for all and reduce disability. Access, already I mentioned to you where I work, the universal access to care, treatment, rehabilitation, and assistive technology is essential. This has a lot of equity issues, even in a first world country like Australia. The suburb that you live, decide the care and support that you get. This need to be changed. And who can change this? It is us, and raising awareness and running this sort of a symposia and educational campaign help us to reduce this gap as best as possible. Education increases equity for those living with brain disabilities. You already heard that I myself was born in a very rural Sri Lankan city, and I'm the first person to get into a university, let alone do neurology and becoming professor, etc., etc. But once you educate one kid, the amount of things that kid can deliver later on has a global impact. So wherever possible, support educational activities without borders and boundaries. Advocacy is hugely important. Before we embark upon the World Brain Day campaign, I remember 2011, I was having a casual chat with one of the other neurologists and then World Federation Neurology president, saying that every other disorder has a day. Brain health is such an important issue, but nobody knows what brain health is. Many of my patients do not know that stroke as a brain disorder. And while 50% of stroke mimics are migraine and headache disorders, we didn't even have a headache society at that time in Australia. So I was having a casual chat that why we should build an advocacy campaign on this. Later on, it went to develop into World Brain Day since 2014. Currently, I'm delighted to say that our campaign reached out well over 1 billion people worldwide. While it may not fix every problem, people talking about brain health is critically important to reduce disability and stigma and target the IGAP now that we have completed 1 year. At the same time, I should probably talk about disability also. I'm not sure how many neurologists are in the audience. I'm sure my good friend David would remember the 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 Foster Kennedy syndrome, or Robert Foster Kennedy. Neurology trainees and neurologists learn about Foster Kennedy because of the contribution that he did for the advancement of neurology. But he has a controversial side also. This brilliant Irish neurologist in 1941 published and wrote the in the sort of eugenic era, supporting some of the German leaders at that time, basically saying that people with disabilities should be mercifully taken away from the society as part of the service to them. The reason that I'm reminding you of this dark era is to remind you of the history where we come from. We now argue that the disability is a human right. During last couple of days, we did a lot of charity work. My wife, my daughter, and few other colleagues are continuing that activity over next week or so in a variety of Sri Lankan cities. But this should not be the case. Disability should be a basic human right, and the disability should be everybody's business rather than some philanthropic people who wanted to achieve. But significant number of countries, and even in rich countries like Australia, some communities, the disability is still based on charity. This need to be changed, and only way that we change is running through this sort of awareness campaign and conversations and putting our resources together. And it is important to remember that disability not only result from the underlying brain disorder or other disorder, it is a relationship between that particular health condition and environmental factors. As Paulette very correctly mentioned, stigma and inaccessible public spaces and lack of social support need to be addressed. You would be surprised to hear, whether we like it or not, almost every one of us are going to experience disability either permanently or temporarily at some point in our life. And this has a strong relationship with our planet Earth and our environment. So when we talk about prevention, we need to take this into account also, and we need to talk about this and educate fellow Homo sapiens on these aspects also. I think I already mentioned to you that brain disorders are the leading cause of disability worldwide, certainly in Australia. You would be surprised to hear brain conditions such as headache, anxiety, and depression. The cost of that to the world is actually outweigh if you put the entire cost to manage cancer and cardiovascular disorders put together. That's the world that we live in, but this fact most of you are probably hearing for the first time. And we do need to raise awareness on these issues as well. Brain disorders in particular, the disorders such as headaches, brain infection, as you heard from people with lived experience, they increase other chronic conditions to make matters worse, such as depression, anxiety, diabetes, obesity, etc. The disability related to brain disorders can cause long-term physical, mental, cognitive, sensory impairment that restrict a person from fully participating in society. I do suffer from migraine. Today, I'm not suffering from an attack of migraine. If I'm in the middle of an attack of migraine, this speech would have finished in the 1 minute or 2 minute, as Etta would probably shut the window and get the next speaker to talk, as I would be talking nonsensible words. This is why it is important that we understand what brain health is, and we put where brain health should be, and raising awareness and the running educational campaigns globally, regionally, and locally. And this include educating healthcare professionals also, as it will reduce the global impact of brain disabilities. I remember when I drafted the original constitution for Australia New Zealand Headache Society, it sat on my desktop for 4 years, as I could not put 5 neurologists together to be interested in headache medicine at that time. So, but you just need to be relentless and keep pushing the agenda until people come on board. I am a firm believer of empowering people and public education. Those of you who are in healthcare would have realized that why the people who suffer from encephalitis wanted to get together with each others, because each person would teach the other person 2 or 3 tips. Going back to Parkinson's disease, I'll give you an example. From textbooks, we knew 2 or 3 things that help people with Parkinson's disease when they experience freezing. But some of my Netherlands colleagues, when they group with a bunch of patients, they started to learn truckload of things from Parkinson's disease patients, and that number now is over 75 things. So the almost over 70 things neurologists were taught, or the allied health colleagues were taught by people with living experience with Parkinson's disease on their tricks of the trade to deal with freezing. Even in that allied health workshop that we conducted in Sri Lanka a couple of days back, we had 17 patients that we invited. I myself learned a couple of things from some of these rural Sri Lankan patients with regard to goal setting and how they dealt with certain things. I'm sure their own allied health colleagues learned that also, and I mentioned the very same thing that I mentioned to you today, covering the entire allied health workforce in Sri Lanka at that time. So we can learn from one another. That include learning from patients also. So together, we must advocate for equality for those with disabilities and address discrimination. We should keep that really dark history as part of the history and never let that sort of a terrible thing ever happen to the humanity. I personally don't like brain disorders to be regarded as a burden and cost and this and that, but unfortunately I have to use the same terminology. For me, these are human conditions and we should humanize all these things as the brain is the epitome of humanity, and prevention and care of brain disabilities must be a responsibility for all of humanity, whether you are black, white, east, west, or whatever. And we must unite our workforce. If you remember the first the slide that I showed you, you would have seen how we put the entire world together. All neurological associations were there with their logos in the banner. I'm using that as my virtual screen also. If I move to a side, the bottom line logos that you see, that basically cover the entire world from east to west, covering all key organizations. Our very own NSAN is part of the Asia Oceanian Association of Neurology. I have put that logo there also. So I am incredibly grateful for this opportunity, and I'm incredibly grateful for the Neurological Council the Neurological Council Western Australia to putting this program together, as this is the key to reduce these terrible statistics and push humanity and protect brain health as best as possible as we all lose our brain function, to extract the best out of our brains so that we can leave a better world to fellow Homo sapiens and other animals to live once we are gone. And as a little bonus, I am sharing few tips to improve brain health. What you all are doing today is actually supporting yourselves. You stimulate your brain. You are moving here and there. I'm standing in front of my PC. Being physically active, stimulating your brain, they are great things. I already told you that how 3 days of social stimulation and seeing new things and doing things and having a stubborn son pushing her beyond boundaries, how it got my mom to less disabled compared to the way that we started 3 days back. Eating healthy, breathing clean air, not smoking, stopping too much alcohol. In my book, the safest level of alcohol is 0. But if you can't maintain 0, at least cut that back and know your numbers. blood pressure, blood sugar, cholesterol. Don't settle down when your doctors say that your blood pressure is good. Ask the number. The lower the number, better it is. Sleep well, preferably much more than what I sleep, not too much, not too little, and protect your head and avoid concussion, and be socially connected. Today, get to know each other's. Make sure that you visit our website, the World Federation Neurology, download our toolbox and share it with whatever the social media links that you have, and see whether you can get to know 2 or 3 new fellow Homo sapiens, preferably from different parts of the world, and help them also. And the meditation, which I haven't mentioned on the previous slide, is an unbelievably useful thing. I became interested in this thing as an 11-year-old kid, having learned about the importance of human mind. This whole lot of literature around this, the amazing benefits of meditation. And you have some of the best meditation teachers in Western Australia, where you can access their resources completely free without changing your religion. The human suffering is universal, and solution to suffering is also universal. So don't put barriers to that. This is my last slide. We are in trouble. Brain health is at peril. 1 in 2 of us are having a brain disorder, whether we like it or not. I myself or Etta or someone else could well be harboring Parkinson's disease without we knowing that, or we could well be harboring some sort of a dementing disorder within us. COVID-19 pandemic showed us the amount of money that we have, or amount of awards that we have, or the qualification that we have, the way that we look is immaterial in front of bugs. They have no respect to who you are or how you look. And given that the brain disorders are the leading cause of disability, it is up to us to make these disorders human, and get rid of some of this terminology that we are using, cost, burden, this and that. My mom is never going to be a burden to me. None of my patients are a burden to me, despite I sometimes have to deal with really difficult patients. I am human, they are human, and we are all trying to protect humanity as best as possible in a human way, not in the Foster Kennedy way. We'll leave that bad history behind, and together we can address stigma. Together we can protect and promote brain health across the lifespan. I think the raising awareness and promoting education across the board, empowering people with and without brain disorders is the way to achieve the IGAP, the target. We got 9 years to go. Our health minister has signed up for this so that it is possible for us to keep them accountable. And Australia also has the unique opportunity using people like migrant workers like us to support rest of the other countries to come with us. Remember, when you look at the world, Asia-Oceania region is home for well over 5 billion people. And we are one of the big brothers in this region. I think we can do a lot more than what we are doing at this point of time to push the humanity and promote the brain health in our region while we take Australia with us. Again, my most sincere gratitude for having me on board, promoting brain health and disability, and keeping the humanity going and making things human. Thank you.
Thank you, Tissa, for your time, and congratulations on your work on World Brain Day, and good luck for the activities tomorrow and over the weekend.